with Megan Vernon for DBT with SUD. Just a reminder, these sessions are hosted by the Southern Utah University Center for Rural Health. The speaker series is funded through the Rural Communities Opioid Response Program grant. We will be recording them, and the slides and recordings will be available and emailed out to those that are registered. Usually by Monday, sometimes by today, depending on how fast we can get it uploaded. Please feel free to share the registration information in the sessions. We will be monitoring the chat and helping facilitate questions. I also wanted to let you guys know that we have on SU, we have a speaker series page where we have all our speaker series. I will send that link out at the end too, where you can find all the slides and series there. So without much further ado, let's welcome Megan Vernon. She is the Chief Clinical Officer for New Roads Behavioral Health. She is DBT. You're gonna have to remind me how to say that again. Linehan? Linehan. I'm gonna get it by the end. Board of Certification Certified Clinician. She is a certified EMDR trainer and has 13 years of experience. That she is a dedicated and highly skilled clinician focusing on helping individuals navigate complex mental health and co-occurring substance use disorders. She's recognized as an expert in DBT and brings specialized knowledge and trauma-focused therapies to her practice, and we are lucky to hear from her. So I will stop sharing my screen and turn the time over to her.
Thank you so much. Okay, here we go. Okay. All right, so again, carrying on. So last time that we went over the skills categories, like the groups of skills that Marcia has. And now today what we're focusing on is the specific skills utilized when the crisis is addiction. So specific for substance use based things. She has 7 basic skills that we're going to go over today. And these skills are found like in the big category or skill sets. These are found in the distress tolerance skills. So like when you are looking in the book or trying to find them, they will be in distress tolerance. And initially it was when like the crisis was addiction. And this addiction can be substances, alcohol, gambling, sex, self-harm, eating disorder behaviors, things that have kind of that the components of having urges or cravings to engage in the behavior, almost like this is obsessive piece, ritualized piece within it. These skills can be very beneficial to navigate through. So we're gonna go through them. So the first skill set is dialectical abstinence. And so this skill has 2 pieces to it. So on one hand, or on one end of the spectrum, we are shooting for abstinence. I'm never going to use again. I'm completely done with using the behavior, whatever the addiction piece is, going sober. And then the flip side of that is acknowledging and recognizing and planning for relapse and doing more of like a harm reduction. So what can I do to, if that does happen, to minimize and get back on track and kind of go back into that abstinence? And so it's recognizing that both of these possibilities are real and we need to accept both. We need to accept shooting for abstinence, and we need to also accept the likelihood, the reality that we are going to relapse and have slip ups that may happen. And the biggest thing that we strive for, like when coaching this, is really like how do we align to your values, the life that you want to have, that you feel like is worth it, make strong commitments within that, and also not go into like a full shame spiral cycle if we have a lapse, and navigating within this space. So within dialectical abstinence, when we're talking about this with individuals that we're working with, we want to gauge their commitment to the sobriety part, the abstinence part. What does that look like for them? Again, this is swearing off addictive behavior completely. And you might be willing to like this is within your own limits, your practice's limits of finding like, okay, is it just getting off of opiates or just getting off of meth? And maybe we'll still allow for alcohol if we can get very structured things within it versus just replacing addictions within that. And so again, within your limits of how strict you want to be on the abstinence, but we're shooting for like, hey, I'm going to live my life that aligns with my values. So you might have to do values work. You might need to figure out what do they value? What's the life they want to have? Because again, if I'm going to tell you to not use, there needs to be a reason for it. That is not just, oh, you're going to avoid being in trouble. It's no, so that we can have this thing that you really want. When you're looking at the harm reduction piece, this is going to have some other things within this. It might be bringing in COPE ahead, relapse prevention plans. What's my plan if and when? So what are the warning signs that I'm likely going to relapse? What are my reasons to remind myself of why I want abstinence? Who are social supports that I can reach out to that are going to be helpful people for me. So you can kind of create these whole like relapse prevention plan, crisis response plans specific for the addiction to help them get back on track if something does happen. Our next skill is clear mind. And so clear mind is also playing within the dialectics. So it is the middle ground between the two extremes. So on one hand, you have the addict mind. Everything is being governed by the addiction. When I'm using how I'm going to use it, recovering from it, the whole ritual aspect of like everything is based off of when I can use. And then the flip side of that is clean mind, thinking that I don't have a problem, pink cloud to the extreme, we're so good, I'm never going to use again, I've seen the light, all good things. And I have nothing to worry about because I've now acknowledged this, right? So clear mind is the middle path between these. It's recognizing that there is still going to be things in the world that are triggering. You're going to have urges, you're going to have cravings. So it's allowing space for the addict mind to still be there, right? Just because I'm sober doesn't mean that my drug of choice instantly disappears, right, off the face of the world. If that was the case, we would be like the most amazing therapist because, like, poof, it's gone, it doesn't exist, right? Yay, yes, with all these things, right? And that's not the reality. And so the clear mind is finding, like, acknowledging, okay, those triggers are still going to be there. And how can I navigate through this, right? So this is, I'm going to take precautions and have things in place that are going to help me stay away from relapse and actively engage in behaviors that align with my sobriety. So this can be bringing in things like AA meetings, 12-step, smart or rational recovery if they don't enjoy the 12 steps. What does self-care look like for them specifically? It's like, okay, I'm gonna make sure that I'm eating, I'm showering, I have clean clothes on, I'm going to therapy, I'm maintaining my treatment, I'm exercising, I'm working towards the goals that we've talked about before, right? And we don't want them to just live in this pink cloud bubble because that is really going to be setting them up. Because I've had several individuals that I work with that when we are in residential, they're fine. Everything's good. We've got everything planned out. And as soon as they leave and they got their phone back, they're the people that they used with were messaging them like, hey, do you need a fix? Do you need a hookup? And it just shifted. Or downtown Salt Lake, where they used to pick up, it still exists. They could find it pretty easily if they want to, or going to the grocery store or a gas station and having alcohol there. And now, like driving and seeing the billboards for your cannabis on demand within things, right? Like all of these things are still there. And so it's not just turning a blind eye to it. It's how are we going to navigate? Clear mind is truly how are we going to navigate through these triggers in the most effective way possible. Now, community reinforcement. So this is where we're going to structure the environment so that it is reinforcing abstinence instead of addiction. So as addictive behavior increases, positive or things that would maintain their sobriety often decrease. And so, what do we need to do to structure the environment to flip and be more reinforcing of your sobriety? So, this could be cleaning out their cell phone, removing numbers, going through their social medias, blocking people, deleting people, going and cleaning out their house, removing the substance, the alcohol, whatever it might be from the ease of access within that. Finding or doing some exposures, like I've done exposures at the grocery store. Like, how can you grocery shop without picking up a 12 pack or whatever their alcohol preference was, right? Within this, how can we go home and find a route home and get used to that without detouring to the liquor store? So we're restructuring the environment. We're actually going into that and setting it up in a way for them to be able to, again, maintain their sobriety. Next, we're also going to replace addictive reinforcers with abstinence reinforcers. So make the lifestyle of sobriety so much more rewarding than the lifestyle with it. So again, from last week, we're going to bring in the ABC please. So what do I need to do to accumulate positives? Where can I build mastery? How do I need to cope ahead with certain situations? What's my physical illness? Limiting my screen time, exercising, balanced eating, my sleep routine. So we're kind of setting these things up in a way for them to be able to maintain their sobriety, again, as effectively as possible, because this is better, right? Like, I'm not having all these negative consequences. I can actually engage with my family. I can engage with my kids again, or I have these new friends. I'm back in school. Whatever the situation might be, to have it be able to align and reinforce their sobriety. So this skill, these are two separate ones, though when you teach them and when Marcia presents it, it's always put together. So the first one is burning bridges. So this is actively eliminating any connection to triggers for addictive behaviors. This is where you're going through and you're deleting numbers, you're blocking people, you're getting rid of photos, anything that might be glorifying their addiction, keeping that door open for their addiction. We're doing what we can to close that off. Then we're also going to really, like, sometimes it is like, okay, when you think of using, who are the people that come into your mind? Is there areas that come into your mind? How can we shift this? Right? So we need to end those relationships. And I think a big hesitation to this is, well, if I get rid of everybody I ever used with, no one's left. I'm going to be alone. And that can be very daunting, right? To change everything, to get rid of all of these connections that for the most part seem very accepting, because if you're using, I'm using, and we're not judging each other, right? Someone's co-signing on my stuff with me. It's great. And so this is where we have to bring in the building new ones. So yes, I just got rid of all these relationships and now I need to build new relationships. So this is where we create new associations. We're going to go to the gym. We're going to go to the coffee shop. We're going to meet new people. What are healthy places that we can meet people? It might be in your class. It might be at a church gathering. It might be using Meetup for an appropriate thing to, like, go hiking, or the grocery store people that you see all the time, right? So it's finding and connecting with new people that are going to support your sobriety. A big thing within this, right, is we have to radically accept that there might be people in our life that we cannot interact with. And we have to commit and recommit that we can't interact with them. I have an individual right now who his dealer is his uncle. And so his uncle shows up at a lot of family functions and stuff. And so he has to radically accept that he might not be able to go to certain family events if key people aren't going to be there. Like, his brother is very supportive of him, and if his brother is not there, then it's probably not a good idea for him to go to that event just because his uncle will be there, and the chances of him relapsing are really high. So sometimes we have to radically accept missing out on things, cutting people out of our life because It's not efficient. It's not healthy for us. And we have to make strong commitments. We're committing to our sobriety. We're committing to keeping them blocked or not going to places. And again, reminding ourselves to not engage in addictive behaviors. We're kind of setting ourselves up to get too comfortable or just put ourselves in higher situations. We're going to really focus on creating new associations and things. So this can be very like on here, right? We put smells, right? With information related to addicted urges. So we're having to make these new associations. And so this can be like a very common thing of like taking everyday objects, things that are going to be in your house, and how can we make a new association that's not addiction based with it, right? Tinfoil can just be tinfoil, and you can make food with it, clean. Doesn't have to be used for substances. Red Solo cups don't have to have alcohol in them. So how can we create these new associations? What is a different smell that you can put within that, right? Because we're trying to reframe. As we're building these new bridges, we've burned those associations, and now we have to reassociate it to a new thing. This is where the concept of urge surfing comes in. And so instead of trying to deny or resist the fact that you're having an urge to use or a craving is coming in, we're learning to surf on top of it. And so I want you to take a second to really just imagine being at the beach and a wave is coming in. And it's going to pick the size of your wave. What happens if you try to stop the wave? So you're going to put your hands out, you're going to kick it, you're going to fight it. What happens? We get wet, a lot more wet, right? Because we're getting splashed, we're trying to fight water, we're getting drenched. And so instead of trying to fight it and pretend like, okay, this urge doesn't exist in this skill, we're going to start surfing. Okay, I see the wave. I know the wave is coming. And so I'm going to surf it. I'm going to get on top of it and I'm going to ride it out. And this allows us, you might get a little wet, but you're not getting to the same. And then you're being able to navigate it a lot smoother in a way more effective way. So again, these two skills are often taught at the same time in tandem with each other, though they are two distinct skills. Next, we have alternate rebellion. And so this is one of the funnest skills. Like you can get so creative with this skill because this is really kind of taking that often rebellious urge, energy, need that we have, but we're doing it in a safer way that does not negatively impact us or have all these consequences that are aversive attached to it, right? Like, so we're rebelling in a way that's not necessarily breaking the law, or if it does, like we're okay with the consequence. Right? Like I jokingly say, like one of my favorite alternate rebellions is speeding, and I totally accept that I will pay the speeding ticket, right? And I just space it out so it doesn't necessarily hit my license or impact my insurance too much with things, right? But we're doing it in a seemingly safe way. We're not being that reckless with it, whatever the alternate rebellion is. So some things that Marsha listed is having ice cream for dinner, which is one of my favorite things because ice cream is my favorite food, right? So we're having ice cream for dinner or candy for dinner. We're going to color our hair in very crazy ways. We might get tattoos or a lot of piercings. We're going to cheat on our meal plan or our diet plan, right? We have our cheat days. We're going to blast our music. So we're kind of rebelling in a way that is pretty safe within things all considering. And so I want you to just kind of think, like, again, be very creative with this. Talk about this with your clients and the individuals that you're working with on, like, what does rebellion look like to them? And how can we shift this? This might be paintballing. This could be, I feel like you can't do this anymore because of ring cams and everything, but like toilet papering, right? Like a seemingly safe, benign thing that's like slightly annoying, but it's really okay to do and rebel in that way. Because it's kind of taking that for some people, the adrenaline aspect of this could really be a main triggering thing of what gets people back into using. And so we're going to set this up in a way where I can still rebel, without having consequences. I had an individual I worked with that went skydiving, and bungee jumping. I combine those two to get that release, right? To have that adrenaline, to feel like they're being risky with things. And it was done in a safe way for their alternate rebellion. Next, we have adaptive denial. So adaptive denial is where we have an unhelpful or unwanted urge, craving, impulse to do something ineffective. And this is adaptive denial because we are essentially going to deny the urge. Again, within this, we're not arguing with ourselves. We're not debating it. When this urge hits, we're going to deny that we want the maladaptive thing. I don't want to use. I really don't. I'm just bored. I'm just annoyed. I feel uncomfortable, right? So within this, we're going to convince ourselves that we want something else, right? So within this example, it's like, I really don't want to use drugs. I'm just bored. So what I actually really want to do is I want to go to a ball game. So I'm going to reach out to friends and we're going to go to a ball game or play a board game or something to entertain ourselves. So we're doing this in short increments. So typically it's to push it off until the urge goes down. Because a lot of research shows us that an urge or a craving, if it's not acted on or kind of fed into, will typically die itself out in about 20 minutes, give or take. And so if I can push this off for a few minutes at a time, or remind myself like, oh, I don't want to use, I'm just uncomfortable. I don't really want to engage in this behavior, right? I'm bored, I'm uncomfortable. I can push this off because then I can do something else. And again, this is a short-term thing because long-term denial becomes ineffective. It's like shoving things down, and that is just going to make bigger relapses happen. So it's checking in, really intentionally trying to just write out that craving, that urge wave, and put it off until those 20-ish minutes go away. So those are the skills specific for when crisis is addiction. Is there any questions on those skill sets before we shift into what happens when there is a situation? And you can either unmute yourself or put it in the chat if there's any questions on those skills. So those are skills that we really highlight when crisis is addiction, in addition to the skill sets that we went over last week. So it's not that you just have these 7 skills. All right. I think we're good. Okay, so finding a new response. So this is the most behaviorist part of DBT. So when we're looking at behaviorism, we have antecedents. So within DBT, all behaviors are caused. There is something prompting them. There is a reason that you're using. There is a reason that you're engaging in the addiction behaviors. And so it's being caused, it's being prompted by something. Then we have reinforcements. So again, think back to your Psych 101 days. Reinforcement increases the chances of a behavior occurring again. I got something great from this. And so one thing to keep in mind is that maladaptive behaviors have been heavily reinforced up until you start meeting with the client. There is something prompting them to do it. Because if everybody used and had like the worst experience with it, they would not use again. Right? I think it's in like the big book where it says like we're alcoholics because we liked it. Right? Like we liked the taste, the feeling, the outcome from it. There was something that we liked about it. I've had clients tell me like the best thing, there's nothing better than feeling high. Like that is like the ultimate thing. And then their substances, they were always chasing that first high because it was just so great for them. So again, thinking of it, this has been so reinforced for them up until the time that usually they're in our office. Things have been reinforced to keep them engaging in it. We're also something to keep in mind, and reinforcements in shaping and changing behaviors work best. So we really want to highlight and pay attention to behaviors that we want to see and reward those. So it can be as offering praise, additional time with the client, if it's within your limits and you're able to do it, taking them out. Like I have a client right now that if she makes it to all of her outside doctor appointments for a week, that she gets Chick-fil-A. We're going to go get some Chick-fil-A, right? Because we really need these appointments. And so if she can do this, we're going to get some Chick-fil-A to like reinforce that she went that, because it's very scary and hard for her to do. And then again, with behaviors, and we have punishment. So these are decreasing the likelihood that a behavior will occur. So again, these are more aversive things. We're losing things that we might want. It's being either taken away. We've had something happen. And the biggest thing within this is natural consequences are going to be so much stronger than arbitrary consequences. And so natural is it's kind of in line, it like makes sense. It's the natural outcome that would happen versus like the Chick-fil-A, that's an arbitrary thing, right? Like I'm inserting that. She wouldn't necessarily get that just because she did it. Like we've attached that to it versus the natural consequences of going to a doctor. It's like, oh my gosh, I feel better because they took out the splinter. Yay. Right? That's a natural consequence that is reinforcing versus the Chick-fil-A arbitrary putting that in there.
There's a question in the chat, Megan.
Yes.
Ben asked, is there any importance in addressing functions of behavior as why they use escape, attention, seeking, etc.?
Yes. And we are going to get into that. So we're going to put a pin in that because this is what we are getting into, because yes, that makes sense. So when we're looking at DBT's approach to substance use, again, we see all problems or all behaviors, so maladaptive behaviors, crisis, relationship problems, everything, as reinforced maladaptive solutions. There is a reason that they are going to those behaviors as their solution. So the problem isn't necessarily that you're using the problem, like using is your way to cope with the problem. And so we're looking at what is the actual problem, what is reinforcing and continuing to have you continue to engage in using. So we really want to focus on creating lives that they view as worth living, that it's meaningful to them, it's full, it aligns with their values, their goals, things that they want for themselves. This can also get really fun and interesting. I've had clients that told me that their life worth living is to become the biggest drug dealer. And I was like, okay, well, how does that align to your values? Like, what's the key things that you think being the best drug dealer is going to give you? And when we actually broke it down versus getting stuck on, oh, okay, we're not going to be the best drug dealer because yay. When we broke it down for them, what in their mind, what that meant was respect, financial security, and like within that, like having nice things. Like those were the things that they actually wanted. And so, okay, how can we have respect, financial security, and nice things? That doesn't mean you're a drug dealer, right? Because we can separate those things because the values we're able to create outside of being the next drug dealer. But yeah. So we also really set this up so that they want, once they have the taste of this good life, of the life that they want to have, it's going to help reduce urges to avoid or escape or go into those addictive behaviors because they don't need to, right? Because if I like my life as it is and I've got these things back, I'm going to want to keep them. And so using doesn't always fit in with that. It doesn't align. And so it helps reduce those urges. So taking into account that these things have been their solution to pain or they've been heavily reinforced, a primary task for us as a DBT therapist is to find a more effective response, right? We're not going to be the best drug dealer. How can we find respect and financial security and having nice things in a different way? So we're going to bring in dialectics. We're helping them see this less like this is my only option. Like the only way that I can get through their pain is to either die, to use, to numb out. And we're going to problem solve and find multiple approaches to get what the actual, to your question, man, what the function, what the intent is of what they're doing. So within DBT, we have what we call a behavioral analysis, officially titled Behavioral Chain Analysis. We nickname it as a chain to discover the intent and then find new skillful behaviors to meet the same function as using did. And then within this, we're also finding new skillful behaviors is to replace those maladaptive behaviors with more effective ones that achieve that same function. So this is where we really are wanting to come in and figure out, okay, why did we use? What were we hoping for? Did you actually get that? And so when we're looking at a chain analysis, it is viewed as the first step in problem solving. So when we're trying to figure out something else, we have to understand and kind of analyze what was going on. So it's usually our first step. And this is a very in-depth analysis of a particular instance or set of instances of the targeted behavior or quote unquote problem behavior. And it is a very focused attempt on, well, our part for sure, ideally the client's end as well, that they're aligned and working through this with us on the factors leading up to, following, and controlling or influencing the behavior. And the purpose when we're doing a chain is to really figure out what is the problem, right? Because using is your solution. So what is the actual problem? What's causing it? What's interfering with healthy resolutions? And what are resources that we can implement to help you actually solve that problem? So the steps, these are just suggestions of a step. So the first thing is we're going to identify the maladaptive or the problematic behavior. So this can be using. I'll just say that for example's sake, we'll say using. We're going to identify vulnerability factors. So these are things going on in the individual's life that is making them more susceptible to using. So think back of like the police skill, because again, the police skill is meant to reduce vulnerability factors. So are they sick? Are they hungover or in withdrawals? Are they not eating? Are they stationary? Are they not sleeping? Did they just lose their job? Like, did their PO show up unannounced? Like, what's making them vulnerable? Did they think that they were going to have a meeting with their kid and then that didn't happen? So what's going on that is making them more susceptible, more vulnerable? Then we want to determine the prompting event. And the prompting event is not always the easiest thing to be able to identify. Because oftentimes people will feel like their vulnerability factors were the prompting event. Some very rarely are they. Usually it's something like what exactly happened to have it happen at this time? Why did we use this day versus earlier in the day or later? Or especially if they've had a little bit of sobriety. So if they've been using constantly, it might be like, okay, what got you to use in the first place? Right? So you might do a chain on their very first exposure to using with things of like what got them into it. If it was just like I used and never stopped type of a thing. So we're looking at what specifically happened that day to set up this series of events. So the way to think of the chain as well is problem behavior is going to be at the end of the chain. Vulnerability factors are going to be at the start of the chain, and the prompting event is what sets the domino effect off in motion from point A to point B. Then we have the steps in between are what we call the links of the chain between the prompting event and the problematic behavior. And these links are going to be emotions that they were feeling, body sensations, thoughts, their own behaviors, external events going on as well. So everything that's going from step to step. And then once we've done this, we are going to identify consequences, both positive and negative consequences. Because again, I want to know what's reinforcing this. Did they actually get what they were hoping for? Were there any negative consequences that they might not be paying attention to? Like I had a session today, or not today, yesterday, with a client that she could only think of positive consequences in the short term and really dismissed a lot of long-term consequences that would come from that behavior. And so part of me is going to highlight those negative consequences or aversive consequences, as well as be very mindful of those positive consequences that are reinforcing and keeping this going. Or sometimes they're doing the flip, they're only noting negative consequences. And so we have to work really hard to find what's the reinforcing consequence, what's the positive thing, because that's going to keep this going. Then we're going to formulate the hypothesis. The hypothesis, this is where it's like, okay, what was the function? Why were we doing this? Why did we do what we do? So Ben, coming to your question. So yes, we are absolutely trying to figure this out. Because it's also like, okay, did it work? Right? So if this is my hypothesis, this is why I think that you're using. And you actually used, did you get what you wanted? Did it work? Right? So we're looking at all of these things to formulate this hypothesis. Chains can be very aversive. I don't know very many clients in particular that love doing chains, which therefore makes it very aversive to us as therapists to try and do a chain. Because you might literally feel like you are pulling out, dragging out every little piece, every link on this to understand and have a good understanding of what was going on for them, what led us from here to here to here. I had a individual had like a binge weekend, and if you asked them what happened, you would have thought that it was raining alcohol and they just walked outside and alcohol fell in their mouth based on the details that they were providing. Which I was like, I don't know what form of Willy Wonka that is, because that does not exist in reality, that alcohol just falls from the sky. And so it was really like, okay, well, did this happen? And you might have to prompt things a little bit to really see, like, was it this? Was it this? Give them some options to choose between. And we won't necessarily stop a chain until we have a hypothesis or that we feel that we understand the series of events, what led us from point A to you engaging in the problematic behavior. Once we've done that, then we move over to what they call the solutions analysis, right? So I know the antecedent, I know what prompted this. We've talked about the maladaptive behavior. We know what your goal, the intent, the function that you were hoping to get from this. Now we're going to look at problem solving. So I have this chain of events. So one thing that we're going to do is we're going to look all the steps along that chain, all those links to see, is there any place that we could intervene to have a different outcome that didn't result in you using? So we're going to minutely put things in there because again, they can call for skills coaching. Did that even come into your mind? Where would you call me for skills coaching? Right? So we're plugging in these more skillful behaviors all up until they engaged in the maladaptive behavior. So typically I like to have individuals identify what I call the point of no return. At what point did the train leave the station and there was no chance that it was stopping and there was no other option than you using? And we mark that on their chain and then we look at what was going on beforehand. That's all the places that we can be more skillful. We have up until that point. And if we don't have a lot of spice, then that's one of our goals for therapy is how can we increase more options to intervene and more space between the prompting event and when you engage in your maladaptive behavior. So when we're problem solving, we're going to suggest everything that we can think of under the sun that's going to get them that same intent, that same function, what they were hoping for. And it can be absolutely ridiculous to very realistic and everything in between. So as we're throwing out everything, we're going to then pick one that we think most likely is going to get us that same function, that same goal that we were trying to get. That's also going to align and get us closer to our life worth living. Then we're going to, once we've picked that one thing, that new behavior that we're going to try that's more skillful, more effective, hopefully, right? We're going to test it out. Now we're going to put this into play and see how it went. And if it works, we are going to reinforce the crap out of that. We are going to praise it. We are going to give them all the hype, the kudos. We might actually give them Chick-fil-A, right? To reinforce, oh my gosh, you did this new skillful behavior. I am so proud of you. Good jobs. If it didn't work, then we go back into problem solving. Okay, we're going to look at, okay, what happened? Why didn't this work? Because we problem solved this. We thought that this would work. So what got in the way? What happened? What maybe made it so it didn't feel effective? And then we're going to either suggest a new thing. We might tweak things to make it might be the same thing, but we just have to implement it a little differently. So we're going to problem solve. We're going to test it out again. Our goal is to align more to how can I get you the same thing? And sometimes it's not going to get them the same thing. And then we have to radically accept and find ways that we can go without things, because there's not a true way to be have the same sensation of being high or drunk within those things, right? Though sometimes I've heard really good things about runner's high with things exercising, like we can mimic a little, but it's never going to be the same. And so we also might need to work on a lot of radical acceptance that it's not going to be the same. And here's all these other things that you're going to get that are you want so much more. You might be able to get your family back. You might be able to have a job. Like we're setting up, again, that life worth living. This is getting you closer to that. If we can't truly replace the intention function, we really zone in, highlight, how can we get you the life that you want to have? So those are DBT. So we have our chain analysis, that's our first start, and then we go into the solution analysis, and this is how to play it again. So when we're shifting from DBT specific and we're moving into the substance use world, Marcia really liked Dr. Alan Marlotte's approach to substance use disorder specific chains. It mirrors the chain process that we just went over, but it contains more prescribed things, like very much like you do this, if it's this, then this is how we problem solve with this, then those generated in like the typical DBT chain. The DBT chains that we just outlined can be way more individualized, much more able to customize to the unique person across from you. And those chains work easier or better, more effectively as the individual themselves becomes more skilled. Because it can help, especially in the solutions analysis, they're going to be a lot more collaborative. They're going to be more bought in with it as well. And Marlotte's chain, Marcia used that to kind of guide her formation of the DBT chain analysis. You can use both depending on who is in front of you, what's your own personal preference on what you like to use as well. And so for today, we're just going to kind of briefly, like this is Marlotte's chain. So this is the prescriptive. So the center line in this is essentially the steps of the chain analysis. And the things above or below, those would be your solutions analysis if we're using the same terminology. And so with Marlotte, the prompting event is there is a lifestyle imbalance that feeds into a desire for indulgence that then increases or turns into, generates urges and cravings that prompts rationalizations, denials, being able to like, no, I can do this. This is fine. I don't have a problem, which we've never heard before with things. And as those kind of generate and continue building up, then it moves into now we're engaging in high risk situations, or I'm finding myself in these high risk situations. This is also going to acknowledge or highlight this lack of coping. I don't know how to navigate. I found myself in this situation and I'm kind of screwed. I don't know how to navigate this because I don't know how to deal with this. Then once that happens, then we have this decreased self-efficacy. We're not really having these positive outcome expectations, or we're in denial and think that it's going to be just fine. I'm just going to use and it's going to be fine. Although, like, it'll be fine. And then we have our use, relapse, initial use, and then that goes into the abstinence violation effect. So those are his steps. And so when on Marlotte's in particular, you're going to ask questions of what is this like for the individual? What was their lifestyle imbalance? What's the thoughts that they have with the desire for indulgence? So you can get more specific, but it is kind of sticking within these categories. So again, you're going to ask questions of like, what was this like for you? What was the rationalizations or denial that you were using? So you're getting the details of the claim, but again, it's kind of keeping it to this versus if you think of Marcia's within this, we're analyzing the link. So this could be, what were the thoughts that you were having? What were the emotions that you were having? What body sensations were going on? What were the behaviors? So it's a lot more broad, right? It's a lot more open. We can describe it in different ways that, again, this can be way more specific for that unique individual versus trying to find the specifics within Marlotte's and have it fit within that box. And then along the way, instead of uniquely thinking or finding a way to do a chain and like the solutions within that, he gives you the specific solutions within this that you're going to be focusing on. And we're going to go more in depth with those next week on like the solutions and the breakdowns within that. And that's kind of going to be our wrap up, and then going into rural environments specifically and how to adjust and adapt as needed within that. Because and so when you're doing a chain, there's a lot of worksheets out there that you can find. Marcia has some. I don't necessarily like Marcia's personally. It's a little more confusing for me just for how she has it. But you can just get a piece of paper, a whiteboard, kind of write it out. We do like to write out the chains, whether it's Marlotte's or Marcia's with DBT, the chain analysis. We want to write it out. If the individual is super aversive to that, you can do it verbally. You can do what we call a verbal chain versus we're writing it down. Part of why we write it down is for the solution side, so that we can really kind of see and we're not having to just kind of remember what we talked about. We have that gauge with things. Because one of the things that we found with whether it's the DBT chain or Marlotte's chain is they start to look very similar. When you see repeated behaviors of using or different things, they kind of align with each other, right? There's going to be similar prompting events, similar vulnerability factors, similar links within the chain, where you really kind of have a sense and understanding of the behavior and what leads the client from the prompting event to using. And so we can know these things, right? With one person that I'm working with, we know that his chances of relapse are much higher when his sense of shame spikes and the thought of, see, I'm permanently damaged, there's something fundamentally wrong with me, comes into play. When those come in, his cravings spike. The chances of him relapsing, much higher. Because those are key things that in all of the chains that we've done are the consistent pieces. So that's why we also like to write them down, is because we can start to see patterns. You can start to see like, okay, this is how this is navigating. This is where things are coming up, and being able to intervene accordingly. So we have a whole list of options like, hey, when shame comes in and that thought comes up, what are we doing? And we really zone in on that. Because we still have a lot of time from when those thoughts come in before he actually picks up and uses. So that's really a lot of where we're trying to zone in with things. So that's why we like to write them down, get more specific, have a lot of details within it. And as we have those patterns and we can recognize it, we can kind of move off of the chains fully and do what we call a macro chain. And a macro chain is kind of more of a glossed over broad stroke version, just kind of making sure that the steps on the chain are the same, or if there were unique things that happened in this particular instance that got us back to engaging in a maladaptive behavior. Okay. Any questions on the specific skills or the chain analysis pieces? Clear as mud. There we go. Yes, model emotion is absolutely appropriate, especially if the function they don't know, like their emotions, kind of breaking down the emotions. That is actually one of the skills that it's not a skill actually, but in your emotion regulation set, Marcia has an outline of breaking down the model of emotions and being able to identify the emotions that you're experiencing. So absolutely appropriate.
Free to also
So
unmute yourself too if you would like to ask a question. And also there's a post survey in the chat.
yeah. So Ben, coming back to your thing of like addressing the function as why they use, whether it's escape, attention seeking, etc. Yes, because that's gonna really shape your solutions analysis once we know kind of what was the goal, what were they hoping for. And if you think of like using is the method, it's not like that's the option or the method that they decided to use to be able to escape or get the attention or, as you said, etc. Cool. All right, so like next week we'll go over like the solution side of Marlot's and then go into the adjustments, accommodations that you can apply for being in the rural communities.
We'll hang out for another minute or two if there's any more questions. I will be sending out this recording plus the slides from this presentation also. And just thanks for being here. We appreciate it. Next week's our last week. So we'll be wrapping this up. Oh yeah. Let's see. Thank you again for a great webinar. Megan's amazing. So happy she's here and teaching us. So
yeah, I was like, you guys just get a lot of hand motions because I'm used to pacing.